Hello, I would like to tell you something about laparoscopic surgeries, very commonly known as a keyhole surgery or a laser surgery. The most technical term to say is laparoscopic surgery, in which a patient is admitted for various conditions like fibroid or removal of uterus or ovarian cyst or perhaps suffering from infertility. Depends on the size of the tumor or the uterus size or what exactly is the ailment. It depends on how much is the recovery time and how many port sizes we'll make. Because we're saying it's a keyhole surgery, a minimal invasive surgery, we don't cut open into the abdomen. We make very small incisions, perhaps one over the umbilicals and two on the both sides, depending on the surgical ease and the surgical procedure. The laparoscopic surgeries have become very common today. In earlier times, when a uterus had to be removed, the only modality used to be either vaginal or perhaps abdominal surgeries. Today, with the expertise of our surgical and plus the instruments we have, we can really go all out with laparoscopic surgeries. And definitely, it makes surgery much easier for the surgeon as well as for the patient. Talking about the recovery time, some people think because it's an advanced surgery, it'll require more recovery time. To the contrary, it's much easier for the patient because the very fact that we're not really making a big incision, we're not making a big cut into the patient's abdomen, the patient's recovery is much faster. Depending on the surgical expertise, some people use laser or bipolar or cautery, and some people do it the conventional way. It all depends on the surgeon. There is no good to bad. It all depends on the procedure and the pathology. I would really suggest in today's day and age, if you have any sort of ailment, and you one should really have all the options explored in and try and settle for a laparoscopic surgery because it is perhaps going to be more beneficial for you as well. The most common surgeries when it comes to laparoscopy we do is the removal of the uterus. It could be in an elderly woman suffering from a bleeding problem, or perhaps a postmenopausal lady, or even a young woman suffering from fibroids, in which we just remove the fibroids, perhaps the tumors of the uterus. Sometimes young girls coming with ovarian cysts and endometriosis, as well as suffering from infertility, also undergo laparoscopic surgeries. In those cases, we remove the cysts, trying to maintain the best we can for the ovarian volume so that the lady conceives. If a younger girl, perhaps not married, is coming with an ovarian cyst, it becomes the most important thing for us to preserve the ovarian volume so that she can have a normal and healthy lifestyle ahead. The most important thing I really want to highlight through this is that mostly people don't understand this. The hormones come only from the ovaries and they act on the uterus, thereby causing your daily, your menstrual cycle every month, and perhaps the uterus works in only holding a baby. So, whenever a lady is undergoing a laparoscopic surgery specifically for uterus removal, I would say if you're already approached menopause or approaching menopause, there could be an option of removing your ovaries as well, and it's not going to be a problem to you. Of course, in the younger age group, if by any chance you're having to undergo removal of the uterus, maybe at the age of 40 or 41, we would try to preserve the ovaries so that your hormonal function is intact. I hope to see you and educate you further on these surgeries, and you should be free to contact me regarding any questions you have further. Thank you.
I know you have